portion of Lifestyles is sponsored by Encompass Health.
Today is World Stroke Awareness Day. Lauren Weil is the Business Development Director for Encompass Health, where excellence in stroke rehab takes place. Good morning.
Hey, good morning. How are you?
I am fine, and we really do need to cover this important topic. What do you want the audience to know about stroke? What kind of awareness do we need to raise today?
Yes, good morning. So as you said, today is World Stroke Day. This is something that is looked at every year, October 29th, to highlight the significance of understanding the risk factors and signs and symptoms of a stroke. 1 in 4 individuals in the world will have a stroke in their lifetime, so pretty significant numbers. So again, the opportunity to provide education to the viewers today. So the first thing I really want to touch on is understanding your risk factors. There are many things that we can't control, including our age, our gender, our race, and our family history that could raise our risk factors for a stroke. But there are multiple things that can be modified that we have control over. And so those are the ones I want to touch on today to help decrease risk of stroke. The first one is high blood pressure and high cholesterol. If you've been told that those numbers are high, it is very important that you have those ongoing conversations with your physician to focus on decreasing those numbers. Maintaining a healthy weight and a healthy, heart-healthy diet, low in sodium and saturated fats, very important to decrease your risk factor of a stroke. Smoking is another one that is a risk factor of increasing your chances. So if you do smoke, it's important to understand how to maybe decrease your smoking habits and have those conversations with your physician of how you can decrease those risk factors. The other piece that I want to touch on is just understanding the signs and symptoms of a stroke. So many times people may not know what those are, and so we do use an acronym FAST, F-A-S-T. F is for face. If you go to smile, one side of the face is going to look unsymmetrical, and that could be a sign of a stroke. A is for arm. If you go to lift your arms and one arm maybe won't raise at all or it isn't raising as high as the other one, that could be a sign that you're having a stroke. Usually all this is going to happen on one side of the body. You could have speech difficulties, and that's where the S comes into play. Maybe you can't get the words out or you're jumbling your words. And then T is for time. Time is of the essence. If you think you are having signs and symptoms of a stroke, you need to get to a healthcare provider, call 911 to be assessed. Outside of FAST, there's a few other signs and symptoms that I want to touch on today. Confusion, loss of balance, having trouble walking, or even a quick onset headache that is not normal for you, a very severe pain. Those are all things that could trigger signs and symptoms of a stroke, and very important, again, that you call 911. Time is of the essence. And so I encourage all the viewers to write that down: FAST, face, arm, speech, and time, and get to a healthcare provider if you think you or a loved one could be having a stroke.
Lauren, thank you so much for all this great advice. And if you are a victim of a stroke, Encompass Rehab Care Plan is second to none.
Absolutely. We are Joint Commission certified in stroke rehabilitation care, where our patients get 3 hours of therapy a day, 5 days a week. Another service that we do provide to the community is a stroke support group that meets monthly, the third Tuesday of the month here at our hospital at 3:30. This is for anyone in the community who maybe wants to learn more about stroke resources and educate themselves. Again, that's open to the community the third Tuesday of every month. And for more information, you can visit our website at encompasshealth.com/deaconessrehab or call 812-476-9983 to learn more about the resources here at Encompass Health to get people back to living.
Thank you, Lauren, for all that great information. It's good to see you.
Absolutely. Have a great day.
You too. We'll be back with more local lifestyles right after this. Stay with us.
This portion of Lifestyles is sponsored by Encompass Health.